Hi, everyone. This is Rachel Richardson. It's noon, so I will go ahead and kick off. If someone could just confirm to me in the chat that, let's see, let me get my chat open. Okay, if someone can let me know if they hear me, I'll go ahead and get started. I think I'm seeing that's the case. So, okay, wonderful. Thank you. Good afternoon, everybody. This is Rachel Richardson. I am proud to say that I am broadcasting from the University of Michigan, the Department of Learning Health Sciences, which is my new affiliation. I'm here in Ann Arbor representing myself and Chuck Friedman, who actually had an emergent meeting today and was is unable to attend, but he has given me full permission to summarize and entertain discussion today. So I'm really looking forward to this opportunity to share with you the happenings and results of our summer meeting, our third annual MCBK public meeting that we had on June 30th and July 1st of this year. So without further ado, I'll move forward with some, of course, my slide advance was not working. There we go. Okay. I do hope to have some time for questions and discussion. So please keep this in mind. And as I'm talking and the different speakers are talking in this webinar, post them to the Q&A. I will serve as a moderator and present those to our speakers today. Just in terms of agenda, my goals are to summarize the content of the meeting. So I'll give you sort of a high level overview of the speakers and participants that we had and some of the topics that came up. I will do that as quickly as I can so that we have time to hear from our 4 working groups, and we've got co-chairs for each of those working groups joining us, and they'll tell you sort of the mechanics of what happened in those groups and really what's going on with MCBK in our effort to move our vision forward. So please do feel free to share those questions. Before I get started, I do want to thank the University of Michigan, the team here, the wonderful team that really put so much work into making this meeting happen. And a particular thank you to Michelle Williams and Janelle Burley, who really coordinated so many aspects of this meeting, and then this webinar in particular. Michelle Williams has really done a lot to help me prepare for this, and is in the process of writing up a meeting report. So there'll be a written record of this meeting available to you and anyone else in the world soon, I hope. So thank you all. And I want to make a mention that Russell's Video Services did what was our first virtual meeting and managed that for us. I also want to thank our steering committee. We have a really expert and diverse steering committee, many of whom you'll hear from on this webinar today, that helped us plan the content for this meeting, and it really took a great deal of work and guidance to do that. So we thank you all. And now let me get to it. The meeting was virtual this year. It seems like forever ago, doesn't it? Now we're all used to virtual meetings and seminars and conferences, but this was my first, and it was a challenge for us to do, to really rethink our content and move that into an online format. The proceedings are all online, so we've got the videos, the slides, our posters are there. So a lot of what I'll be doing in this next few minutes is just giving you almost a teaser of the topics that were covered. I can't even begin to do justice in a short summary of some of the great ideas and content that we had here. So if you go to mobilizecbk.org, that will get you can navigate to where you want to go to find these proceedings. We did meet over 2 days. We had over 200 people registered, and we had 239 unique participants at different points in this 2-day meeting, largely from academic medical centers and universities, about 40%. And then we also had a large contingent from commercial and industry and consultants, about 27%. And then we had multidisciplinary clinicians, folks from government, folks from professional societies, health plan providers, and then a sprinkling of students as well. So I'm going to channel Chuck here, and this is the part of the talk that he usually gives, because this is really his he connects this concept of computable biomedical knowledge so strongly with learning health systems, for which he is very passionate about building infrastructure and ecosystems for. He and I both agree that knowledge plays a really critical part in these learning cycles, and I don't think many would argue with us there. So as we move from to try and go from data to knowledge, and then to put knowledge into practice, and then to take that practice and into performance as data, and look at that, this continuous cycles of data to knowledge is really fundamental to the concept of a learning health system. And the idea of knowledge as it fits in there is clearly a foundational as well. But the challenge is that there's a limit between human readable knowledge and what we're talking about here as a group. Human readable knowledge is really necessary but not sufficient to see the kind of action that we want. And if you think about how a paper of, say, a promising new prediction model, how that would be put into practice, it's not immediately apparent from a written format how that would go. And so we know we have a long gap of evidence to knowledge. Excuse me 1 second, I have to move this. All right, sorry. Life calls. We've got a long knowledge gap in terms of getting evidence into practice. And how can that be facilitated? Computable biomedical knowledge, something that's in an executable format that can support immediate action, that can be integrated into information systems and workflows in an automated and scalable way. And so we feel that computable biomedical knowledge is really central then to this concept of learning health systems and the learning health cycles that constitute those. So learning systems, again, if we can imagine taking evidence, putting it into practice, monitoring that through data, generating new knowledge, if we have many, many cycles of this, then we can support many, many users to actionate this knowledge. So we could really support mass action, and that is our goal. And so mobilizing computable and biomedical knowledge in a large way is what unites us. That is what MCBK is, and I'll point to our manifesto, which many of you are probably familiar with. If not, it's on our website. This is a set of principles that we developed at our first public meeting 3 years ago that really that bind us around this idea that we need knowledge in formats that can be used at the points where decisions and health activities are happening. So this is what grounds us all. And then in terms of our meeting, let me now switch gears and highlight people that then took this concept and moved it forward. We were so fortunate to have Dr. Patty Brennan from the National Library of Medicine give our keynote again, and she shared really information about the role of the National Library of Medicine in the COVID pandemic, which was just still early emerging at the time of our meeting. And she talked about their commitment to providing data and knowledge to users everywhere in formats that are useful to them. And she also reinforced their commitment to advanced analytics and said that their initiatives to improve implementation guidelines for clinical care and research is at the forefront of what she's doing, and it was particularly relevant at the time of COVID. She highlighted some emerging activities, the new PubMed, taking sophisticated algorithms to again bring people the information and knowledge that they need in formats and in a relevance that is important to what they're doing. And then she also mentioned their commitment to the vaccine development process and some partnerships that they were starting with pharmaceutical and other stakeholders to really make data and knowledge as available as possible to those that can use it to then help curb the impact of this devastating epidemic. And she finally hinted at some or shared future funding that they're working on in the area of data design centers and a number of requests for projects and support that they will be soliciting to provide data that is useful and quality and trustworthy that can be used to build upon and create more knowledge. So she's certainly connected all the activities that are part of the mission and the strategic plan for the National Library of Medicine, and how those really relate to what we're trying to do here, which is to mobilize computable biomedical knowledge for health. In the spirit of the library's critical role in what we're trying to do, we next had a panel of 4 professionals from the library and information science community that was just terrific. This panel was moderated by Terry Wheeler from Weill Cornell and Chris Schaefer from UCSF. And they fielded a lot of questions and discussion around the unique role of libraries in the mobilization of computable biomedical knowledge. First, Chrissy Holmes from Northwestern University presented her concept that libraries can really empower a collaborative ecosystem. And she talked about her approach to build on infrastructure, inclusiveness, and operationalize a process for bringing together data, information, people, and perspectives. Then Violetta Illich from Adelphi University discussed technical systems in the knowledge revolution, stressing that libraries should be constantly readapting in order to provide enriching and useful experience for their users and to support research and critical inquiry. Dr. Jeff Oliver from the University of Arizona Libraries then talked about the importance of human capital and building capacity for computational literacy in addition to data literacy and some of the challenges in that. And he talked about his work in building the carpentries, or building skills and training in data literacy and software design, and how this needs to really trickle down across all of our libraries, and particularly our health center libraries. Then finally, we had Bart Ragon from University of Virginia Health, and he modeled library science as the key to moving knowledge forward. And he emphasized open source and presented a number of examples. And he really charged us to think about what's the role of the library of the future. Are they gatekeepers, creators, or consumers of computable biomedical knowledge? So it was just a terrific panel. Next, we had a panel that really focused on the role of CBK in biomedical research. And so Grace Pang, who's a program director at the National Institute for Biomedical Imaging and Bioengineering, described how her work intersects with the MCBK vision. She talked a lot about research in lower back pain and all the models that are being developed around just describing and understanding the pathology of that pain and different points of intervention. And she also talked about the promotion of medical simulation research that's capable of evaluating skills acquisition and outcome assessment and technology development as we educate our health professionals of the future. And Herbert Swaro from University of Washington highlighted the importance of models. Again, he used very timely COVID-19 and the proliferation of models that we're seeing, and really underscored the importance for us to maintain these models in a way that they can be reused and reproduced in a smart way. So he described right now the current status of how biomedical models are published. And it sort of ranged from not at all to being posted on GitHub to being posted on websites and that kind of thing. But there's not quality assessment, there are not standards. There's a number of challenges to providing the details that are required to make these models really usable in real settings. So it was a terrific panel, and I encourage you to watch all of these. Finally, we had a panel from industry, well, not just industry, I'm sorry, but platforms in action. So knowledge infrastructure. This is more of a demonstration type of panel. And so we had 4 people. It was moderated by Peter Emby, talk about some of their work. Dr. Lynn Brandt from the MAGIC Consortium, and MAGIC stands for Making Grade the Irresistible Choice. So really putting evidence into practice. The Evidence Ecosystem Foundation talked about her work and presented a case study on how structured guidelines feed into the biomedical knowledge community and stress the importance of trustworthy guidelines. Dr. Saviero Mabiglia described from CEMIDI, described 7 requirements for managing knowledge infrastructure, including depth, provenance and metadata, versioning and lifecycle, dependency management, search and query, and validating, and the need for testing and learning. So that was very insightful. Dr. Alan Flynn, also from the University of Michigan, our Department of Learning Health Sciences, talked about the knowledge grid and how the opportunities for standardizing CBK that could drive an open infrastructure of the future. And he talked about a future decentralized web approach to this, and describes this dual view of CBK artifacts as both resources and services. And finally, last but not least, Dr. Blackford Middleton addressed the knowledge dissemination and execution of Apervita, which is a private platform that operates similarly to an open standards approach for knowledge representation and engineering, and explained that there's a value to co-locate data and knowledge in the cloud so that they can be, these knowledge services can be applied when and where they're needed. And moving into day 2, we had, if I can manage to turn my slides, which is not, let me change my view here. Okay, sorry about that. We also had a lightning poster session at the end of day 1. I'm sorry. Peter Boisvert, also from University of Michigan, did a great job moderating this session. We had 1-minute presentations from each of our poster presenters, and it went off without a hitch. We had 26 different posters. We grouped them as project posters, which were foundational or applied, and then technical posters that had represented standards, platforms, methods, and applications. So those are all on the web, and you can look at those. Now, finally, as we moved into day 2, we wanted to reflect a little bit on where the MCBK was going within the US and abroad. So Chuck described our progress and our history and some of the MCBK movements that are sprouting up in different countries. And then we were fortunate enough to have Drs. Philip Scott and Jeremy Wyatt from the United Kingdom share their experience as co-chairs of the MCBK UK effort. And they had a great meeting last year, a tremendous amount of participation and consensus to really move forward on this idea. And they have already published the proceedings of that, some very thoughtful and insightful perspective pieces that you should look for on their website and ours, the terrific work. And then finally, to round out this panel on the state of MCBK, we had Steve Bernstein from the AHRQ, and he talked about intersections between the significant amount of work that AHRQ is doing in terms of getting knowledge into practice. And he highlighted the AHRQ's Care Transformation Support Initiative, the ACTS or ACTS initiative, and explained that their stakeholder-driven approach and described AHRQ digital knowledge platform as a point of intersection with the MCBK community. So that was very insightful. And again, I encourage you to find these presentations on the web. And then our final panel was very important, and we're tremendously excited about with great feedback from a stakeholder engagement panel. So Josh Rubin from our team here did a great job moderating this. We had 2 speakers. We had Michael Fitz from University of Alabama, Birmingham Libraries, and a patient advocate in the area of Parkinson's disease. He really shared his experience and offered insight opportunities and vision to where computable biomedical knowledge would have made a difference in his experience as a newly diagnosed patient, and then moving forward and interacting with providers. And he has a deep passion for the changes that we need to make in terms of the interactions between providers and patients in our evolving health systems. And so that was a great talk. And then Sally Oken shared her experience from just decades of work within the patient advocacy community as well, in terms of getting data in a usable way. So she's got a long history of patient engagement and research, and she described ways to ensure the democratization of computable biomedical knowledge, and shared with us 6 person-informed principles that her communities have been working on also for a number of years, and that she thinks are foundational to CBK implementation. And these principles include continuous and shared learning, respect and empower for individual choice, informed consent and understood consent, people first governance, open communication, inclusivity. I mean, some really strong principles that really resonate with us as we grow our MCBK community, and just the synergies there were just undeniable. And finally, Chuck and I tried to close out this great 2 days of meetings, which included some work group time, which we're going to hear about shortly. We'll hear from the different work groups. And we invited Doug Van Houweling, a professor emeritus here at University of Michigan, and one of the developers of really the internet and how it has transformed universities and libraries. And he shared his perspectives from growing that kind of community and that kind of infrastructure change and the ecosystem around that. He highlighted, the robustness of our meeting, some of the topics that came up, really challenged us to think how as a community do we want to move forward and how should we move forward? What are our strengths and what are our unique opportunities? He also took a moment to really reflect on the manifesto again and say, we're here, this statement that knowledge to improve the healthcare, health of individuals and health of populations is really quite a bold and audacious goal. And that what can we do as a community to get there? We certainly have a convening power. We did get 200 people and we've been upwards of 100 for our two previous meetings. So we're convening a large and talented group of individuals that represent so many different perspectives and settings. And so the question is, how do we move forward and how do we think about cohesion and community and collaboration and driving us forward? And then of course, logistical issues like funding and purpose and value proposition. So he gave what I think is a nice summary of where we're at. And so we thank him for that. And again, I'll encourage you to listen to some of these talks. And with that said, I'm going to now go to the work group summaries. And we've got co-chairs here who are steering committee members as well to share. So we've got 4 work groups, standards, technical infrastructure, policy, and then a sustainability inclusion work group. So we'll start with standards, and we have Bob Greenus here to share. Bob?
Yeah, good morning, everybody. Hear me okay?
Yep.
Okay, good. Well, first of all, I wanted to say the meeting surprised me in terms of how early in our COVID isolation period we were and how smoothly it went off, including what Rachel mentioned, but also the transition to breakout groups and reconvening and separate work groups within the breakout groups. It all went very, very well. And I extend, probably on behalf of all of our co-chairs, kudos for that. The standards work group, Bruce Bray has clinical duties, so he was unable to be with us today. We actually also have an unsung hero, part of the University of Michigan team, Alan Flynn, who's really acted as a co-chair and carried on a lot of activities with us, who also had obligations. I think they were teaching obligations this morning. So I'm the presenter for this activity. I will say that kind of trying to find the important place for MCBK in the firmament of all of the activities on standards and so on. We actually have alighted on kind of a meta level approach to coordinating the activities of the various standards and representation efforts, knowledge management efforts, and so on by looking at metadata, of kind of an unglamorous topic, but really an essential glue to the whole process. And so what we have looked at over this past year, actually started it before that, is how to make metadata available that will facilitate access, the FAIR principles, basically make computable artifacts findable, accessible, interoperable, and reusable. And we actually have augmented that during this year, mostly more formalized after the meeting, so it's not on the slide, but trust is another access. So it's FAIR plus T as the principles that we are considering. And what we have started kind of before this, actually about 3 months, I think 2 or 3 months before the virtual meeting, was an activity to create a white paper laying out the categories of metadata that are needed to achieve these FAIR plus T principles. And we kind of the focus is trying to balance the difficulty and challenge of having a knowledge creator fill out lots and lots of attributes and making them also usable so that people that want to consume or implement or develop knowledge or actually manage the knowledge don't have or have maximum ability to actually find the one knowledge that they need for the point of care or point of action. So it's a difficult challenge. And another challenge is how much of the data of a knowledge artifact should be in the metadata. Because, take, for example, a decision rule that has a lot of condition clauses and actions and so on. And if you want to really fine tune the availability of those and be able to access them, all of the elements of it might potentially be searchable for, let's say, trying to find the right knowledge for a diabetic patient with chronic renal disease on such and such treatment that is having elevation of blood pressure that's not well controlled. Well, so how much of that do you put into the metadata? So we're going through a lot of discussion about the right level of metadata descriptors. And we also are drawing a distinction between metadata categories and individual elements within it. So we have actually, and we started this before the meeting, had 12 or so metadata categories. It's now expanded to about 15 and reworked. But within each of those categories, there are many facets of aspects of that. For example, purpose metadata might be who it's intended for, what it's intended to do, what's the target population, what time or point in the care process does it occur, and so on. So and then there's overlap. There are a lot of issues of overlap of the various categories we've developed, and it needs to be unambiguous in terms of who it relates to, and for a metadata developer, or let's say a knowledge creator that needs to describe it, how does that person decide where to put various descriptors and what descriptors are essential? So we're going through a lot of that. And what we did in the meeting was to take 3 representative categories of metadata: biomedical domain metadata, which is now just called domain metadata, but was really distinguishing between, for example, biologic or genomic versus clinical versus educational knowledge and other kinds of domains, and maybe subdomains within those. Purpose metadata, which is actually now called intended use. And that has the multiple aspects that that I've mentioned, and then some. And coverage, which is was now called basis. And it really is how is that knowledge derived? What are its constraints? What are its limits? And so on. And so what we did was to have breakouts on each of those, moderated by co-chairs, and also Peter Haug, who volunteered to help us. And so we made some headway on it, but the main goal of that was not actually to solve anything at the meeting, but really to introduce this effort to the participants and to invite them to continue, because what's going on now and through probably November, maybe later, the development of a manuscript targeted for learning health systems that Alan Flynn is coordinating, and we're meeting weekly. And in fact, there's one going on right after this session, and people are invited to participate in this. I think it's a very important effort. It's actually much more difficult than one would think. So I hope I haven't gone too long here, but if we have any time for questions, I welcome them.
That's a perfect summary, Bob. We just put the reminder to folks to post your questions to the Q&A. I don't see any yet, but we just got that announcement out. So I'll do a quick call before we move on, and we'll have some time at the end as well. But any comments or questions for Bob on the standards group in their particular activities? Bob, what do you think was the biggest challenge of having this in a virtual format?
Well, I think when you're having lots of discussion about difficult topics, it'd be nice to put them up on a whiteboard and have people,
Yeah.
critique and in real time modify it. So the interaction is a little stilted, a little awkward. Um, but Zoom, we're all getting used to Zoom and being able to do this more and more. And having a Google Docs or something like that, which we did in our sessions, to be able to work with was reasonably suitable. So I think
Yeah.
it actually worked pretty well.
Yeah, terrific. Yeah, I agree. I was really surprised at the level of engagement and sort of document sharing and idea sharing that people could do there. Let's see. Floyd Eisenberg asks, where could he find a list of the 12 to 15 relevant categories?
Well, so this is actually the ongoing work of that task force, if you will, that's building this paper. And I think Alan Flynn is coordinating that. There is a Google Doc that he can post. I think we welcome participants, anybody who wants to be either a passive observer or a contributor to the effort is welcome to join this. It's not a closed effort at all. And so please write to Alan. Do we have his email handy?
Yeah, we'll put that with the file for this and probably.
Maybe you can type the answer to the in the Q&A.
Yeah. Oddly enough, I don't have, well, I guess I do have the whole team behind me who will help answer those. I'm going to hold, Chris Schaefer asked a really good question. I'm going to hold that for the group. And then one more quick question, and then we'll move on to technical infrastructure. Jeffrey Gebert asks, has there been engagement with HL7 on CBK standards development? Is there a quick answer to that?
Yeah, I should have actually mentioned that because Bruce Bray, for example, has been very involved in both OMG and HL7 standards efforts on building metadata for CDS. So we are coordinating with them and with other entities.
Yeah, wonderful. Okay, and then I can't resist. Very quickly, Floyd Eisenberg also asked, I see FAIR on the slide, the FAIR principles. Are we using those with the metadata? Is that one of your goals? Maybe that's probably the quickest answer.
Yeah, well, so each of the 12 to 15, actually, the reason I say 12 to 15 is we're continuing to split and consolidate. It's a fluctuating target. But each of them has a principal attribute that is ascribed to it. So purpose would be basically for findability, to narrow down the scope of what you're trying to find. And accessible relates to the standards that are used and things like, or the rights management, for example. And interoperable relates to standards and ways of accessing.
Right. Perfect. Great. And yeah, and let's just, in interest of covering all our 4 work groups, I'm going to move on, but this is great that we've got such wonderful questions, and hopefully we will have a few minutes to get to those. I mean, quick answer, Floyd, there's not, that I know of, this is not a sponsored project by any of the HL7 work groups at this time, but the synergies are there. There certainly is quite a bit of overlap. As Bob had mentioned. Let me move on to now our technical infrastructure working group. And I would be remiss if I didn't acknowledge our 2 co-chair emeriti, Chris Schaefer and Leslie McIntosh, who have just done so much to build this over the last 3 years. And we now have a new co-chair, Jamie McCusker, who will give an update on this part. So Jamie?
Hi. So when we actually had this meeting, I was a participant, and by the end of it, I was, I guess, a co-chair. And we're still looking for a second co-chair because I can't be a co-chair without another co-chair. So get in touch with me or Rachel or pretty much anyone at UMichigan if you're interested in helping out with technical infrastructure. We've got a lot of interesting projects going on in there. So the meeting itself was really interesting. One thing that we focused on was highlighting a number of the a number of the posters from the general session for more in-depth conversation. And so we had posters from basically a number of students, a number of researchers and infrastructure people. And Rachel, if you can move to the next slide.
Hold on.
It's sticky now.
I'm getting there. I don't know what's with my keyboard. I think I have to. There we go.
Okay, there we go. Right. So so we actually had a number of presenters that talked basically about a lot of different ideas around technical infrastructure, implementations for sharing and working with computable biomedical knowledge. And we got to see a lot of different ideas around both what that knowledge is and how it can be used. So that was actually really great discussion to have. The other side of the breakout meeting was actually to talk about a white paper we're working on that we're thinking of as essentially principles for a CBK technical infrastructure. Now, it's actually interesting that the standards group specifically brought up FAIR as kind of a guiding set of principles for standards. And actually, that's actually the basis for our paper. We kind of went through what, each of those letters along with trust to actually figure out what that looks like for knowledge instead of for data. And so that's actually been a really interesting effort. We're going to we're currently editing that paper, and we invite participation from the other groups. It might be that this is might make sense to have it be a joint paper between standards and infrastructure, but we can figure that out as we go. And then the thing that we're actually looking at doing kind of in the near-term future is that we want to get a survey of the landscape of existing CBK infrastructure. So we actually have a number of presentations at the meeting talking about different CBK implementations, and we certainly invite all of them to kind of so we can have more in-depth conversations about both the principles that we laid out in the paper, but also in terms of kind of what they see their needs for a broader infrastructure would be. And also people who have ideas for different kinds of implementations or for infrastructure, different ideas for how you might actually share that share knowledge across implementations, and other people who might have existing implementations. So yeah, we're looking at kind of expanding our view of what's out there. So yeah, that's the bulk of it. I'm still getting my feet under me with this, and so we had monthly meetings for a while. I think our next monthly meeting is going to be the week after next on Monday, and I'll set that up as soon as I can. But we've been having kind of monthly discussions around technical infrastructure, which has been really great.
Great, thank you. And we'll share that information for everyone that's registered here, as well as on our website when these meetings begin. You have a question in the chat here from Josh Richardson. You mentioned trust as part of the considerations of this working group? Any plans to run any of its work past the TNP committee?
TNP, oh, absolutely.
Oh, you mean, as part of, I guess that means the MCBK trust.
Yeah.
Okay,
Well, yeah. So I think that in some ways, we are we're the plumbers of the group, and so we kind of want to make sure that whatever we're kind of proposing, or at least we're trying to attract the attention of the plumbers of this world. But that means that we really want to try to get we do need to interact more explicitly with the other groups, because I mean, it was actually the standards group that mentioned trust specifically, but for instance, even in my research, trust is really essential and actually a big part of what I'm actually working on personally. So absolutely, we want to make sure that we're kind of cross-pollinating all those.
Yeah, terrific. And that is just a general issue for MCBK as we move forward, this need to sort of cross communicate as each group gets deep down in its areas and issues. There's clearly a synergy. And I know we've talked about the synergy between the standards group and the technical infrastructure group. There's so many relations there related to the work that both of you do. One final question, Jamie, before I move on, just to hear from the other working group. Actually, I've got one comment and one question. Jeffrey Geppert asked maybe if you could offer an example of a principle for technical infrastructure.
Oh, crap.
Open standards. How about open standards?
Yeah. So fortunately, I think I actually have the draft open, so I can look at this.
Yeah.
So there are we have 3 guiding principles that we talk about in the paper. Promote interoperable systems for data and knowledge for to be findable, accessible, and reusable. That's basically part of FAIR. Encapsulate knowledge objects and systems in an environment of accessibility and openness, and enable stable, trustworthy knowledge representations that are human and machine readable. So those are examples of the principles that we're laying out currently in our paper. We draw a lot on the actual on the original manifesto for those. But then the FAIR principles themselves are principles, right? So interoperability, accessibility, and so forth. Those are principles as applied to data that we found useful and important. And we're essentially, to some degree, we want to put together a similar, basically a FAIR paper for knowledge. It's not necessarily going to be just FAIR, but is about kind of like, well, what's actually needed when we're talking about knowledge as opposed to data.
Yeah. Great, thank you so much. And then there's a few other items in the chat, but I want to move on, so I'll condense them. First, I want to say Christy Holmes offered a resource that might be useful to infrastructure effort. It's the CORE, C-O-A-R, NGR repository. We're using this to help guide local work, and it's a great intersection of behavior and technology. So I'll get that to you, Jamie, and others as part of the notes from this webinar. And then how to join. Someone asked how to join the group and participate in this paper. If you go to mcbk.org, you can sign up for any work group of your interest. And so you could choose technical infrastructure, or we will also push notifications about those meetings once they're, we'll push those to the list of people that are interested in the TI group, and then you can find out about the paper from there. Let me move on now to our policy and coordination to ensure quality and trust. And I think we'll have Jody Platt start.
Yep, and Blackford Middleton is also here, so we'll sort of share this presentation. So thank you all for being here, and it's exciting to see you all again in this new virtual world. See, some of you guys in the participant list are also on our working group. So, you know, as you're asking questions, there are other things to, a few other comments to add. Welcome that as well. So just again, sort of quick background in terms of who we are and what we do. Next slide is we are engaged in questions around policy and trust. And clearly that's been, it's one of these cross-cutting issues that works across multiple groups. And we've identified a number of activities that we would like to be working on. And what we did this year at the annual meeting was to sort of begin to move some of that work forward, specifically around what does the map look like in terms of what we have available for digital computable biomedical knowledge repositories and their sustaining organizations. So next slide. So one of the things we've been doing for the last couple of years is trying to sort of develop a common language around knowledge repositories and figuring out what a knowledge commons really is. We did a lot of that last year, and we reviewed some of that material again this year. And one of the byproducts I think of a lot of this work is identifying a number of principles in addition to FAIR that have been identified for digital repositories around data, but also sort of little by little, those are also coming out around knowledge repositories as well. So this is just an example of the kinds of things we were talking about this year and the kinds of principles we were looking at. And this is, again, just a sample. There are a few that are missing, like the CARE principles out of Genetic Alliance and a bunch of other, and you know, a few others. But building off of this work, Blackford, I think, can now talk a little bit about what we're trying to work on, which is to begin to survey this landscape. So next slide, Blackford.
Thank you, Jody, and good morning, good afternoon, everybody. And what a pleasure to share some time with you all again, and frankly to hear Bob Greenis, among others, Jamie as well, talk about trust. You know, in a way, as an applied clinical informatician, user of these knowledge artifacts and creator, implementer of them as well, we find the trust dimension to be extremely interesting, challenging, and perhaps novel, and maybe one of the things that will help us get over the hump in terms of actually creating repositories and libraries of computable knowledge artifacts to share. In this work we're describing today, we aim to survey, we've developed a survey instrument, a questionnaire, to survey those who run knowledge repositories of one kind or another. It's a fairly loose description, but it has to be a repository, for example, like the National Library of Medicine Value Set Authority Center, which has something used in a computable knowledge artifact. And there are many, many others, as you can imagine. We want to survey and identify the common themes that folks are considering and using or aiming to abide by in their own knowledge management best practices, and then specifically focus on those aspects which support FAIR principles in the management of those knowledge assets, including, you know, a trust principle. We think a long-term objective of this research could be to create a trust metric of a kind. This builds a little bit upon the AHRQ-funded CDS Connect work, where the idea of a product information label for a knowledge artifact was described very briefly, but not really operationalized. We think that knowledge artifacts might, like pharmaceuticals, have a product label that describes their intended use and appropriate use, and then allows for feedback in kind of a population crowdsourced way. So we're in the middle of this work now. We have finalized and road tested the survey instrument. We did do a test run at the annual meeting, got a lot of useful feedback, and are now refining the instrument based upon that feedback and refining the target list. And hopefully we'll have a contribution to make in the literature maybe before the end of the year.
Terrific. What a great update. Thank you. And again, I see the synergies between what you're doing and the metadata group and the infrastructure group and in our next group, which we'll hear from shortly. Quick reminder, if there's anything, any questions or comments for the policy group to share. Otherwise, I'll just quickly summarize. 2 people commented, it's relevant to really all of our work groups. 2 people asked about licensing recommendations and if those would be addressed in, for example, the white paper that the technical infrastructure group is doing. Preston Lee mentioned that this type of guidance is more grounded and pragmatic to practical architects. And Bill Hirsch pointed out Melissa Handel's work, extending FAIR to be FAIR TLC, traceable, licensed, and connected. So I know that's part of your realm. That's on your radar as well, but wanted to share that with the audience. Did you have any particular challenges with the virtual format for your group?
Jody, you want to start?
We're used to it now, right?
I'm not sure we had any particular challenges except those that everybody's facing. I think we had some really nice, sort of very small breakout groups, which was, allowed for some, very close conversations, which was helpful, and I think gave us good discussion around what and advance the work that we're doing. I don't know, Blackbird?
No, I agree. I think the breakout room feature function was fairly easy to use, frankly.
Mm-hmm.
Yeah, I was surprised. It was, it seems like forever ago, doesn't it? But this was really new to all of us. And there were many weeks of planning. We kept saying, no, we're going to have the meeting. We're going to have the meeting. Really, we all care about this. But now we're deep in this world of virtual meetings. So we did well, and it's glad to see the engagement we had. With that, let me move on to our final work group. But last but not least, we have the sustainability for mobilization and inclusion. So Jerry, I'll let you give that presentation and describe Chris's transition as well that will be coming soon.
Sure, thank you so much, Rachel. So I'm Jerry Perry, and I'm at the University of Arizona with the libraries there. I'm Associate Dean for the Libraries and Director for the Health Sciences Library. Alas, my co-chair for this group is not able to join us today, and that's the wonderful Chris Dimmick. She has been co-chairing for a couple of years with me on this, and she is the Director for the Division of Digital Healthcare and Research for the Agency for Healthcare Research Quality. And it's been terrific to be working with Chris on this effort. And I'm happy to give a report on what we were able to do in the annual meeting. Rachel, could we have the next slide? Thanks. So just to ground us, as some of the other co-chairs have done, our purpose has been really to mobilize a diverse group of stakeholders in the ongoing and active engagement and participation around the value proposition of CBK. And our focus has largely been on advocacy, and our tools, our communications, engagement with those key stakeholders. Jamie, in describing infrastructure, joked that perhaps that group was the plumbers of CBK. So maybe we're the marketers, the mad people, madmen, madwomen. In any case, we are in that effort to mobilize, and that's the key word for us in our labors. Next slide, Rachel. So again, a little more framing. Our long-term goal has been to identify and engage with stakeholders representing all aspects of CBK. And one of our passions, of course, is to ensure that these diverse voices and perspectives are included. That's a big part of what the inclusion is in sustainability and inclusion, right? We're also trying to build momentum around CBK through communications. And in that capacity, we're using various strategies and outreach engagement. And we also want to discern whether there are gaps in our knowledge in the communication and where these gaps function as barriers to accelerating the use, deployment, and the creation of CBK. For all the great reasons that Rachel indicated at the outset, right? We're really wanting to move this at scale to improve the quality of healthcare that's being delivered. Now, we do have some short-term goals that we've been focusing on the last few years. One of those is to advocate with key organizations and professional societies, and the other is to advocate through scholarship. And as regards working with organizations and professional societies, we recognize that we are social individuals that exist within networks of shared interests. And we want to leverage those networks. Those are an important way for us to engage with other constituencies who have a shared passion and shared vision and interest in the CBK activity and that work. So over our last few meetings, at the annual meetings, we've had a number of conversations about what it means to work with our other organizations and how might we engage with other professional societies. And then, as some of the other co-chairs have presented, advocacy through representing our ideas and getting them out there into the broader marketplace of concepts and thought largely can be done through publishing and getting that content into accessible repositories and places where we can have that dialogue and that conversation about the work that we're doing. So we're also focusing in our group on this component. Next slide.
Hold on. I don't know why my keyboard. It's just might have been something.
So during the work group session and the annual meeting, we had a couple of foci. As I mentioned, we talked about working with the large organizations, and we wanted to target one or more organization to start developing something a little bit more formal. We don't want to be too rigid, of course, or structured, but so we've landed on this notion of an ambassador role or a liaison, somebody who travels essentially between two groups with a shared interest and can establish the means and mechanisms for ongoing and persistent communications. Because to be sustainable, we have to have that ongoing persistence that is beyond our individual selves and as we come and go in these various activities, but persists. And we're also thinking about what are the kinds of collateral that we might need in order to do this kind of work. And by collateral, I mean whatever promotional or marketing or communications items that we need in order to do this work effectively. And we want to, as I mentioned, advocate through scholarship. And so we've been thinking a lot about our various ideas that we might want to land on. There's been a long-standing interest among the group to talk about issues that arise through we think about CBK, we think about artificial intelligence, we think about other kinds of technologies that can be viewed, certainly by external communities, as black box and perhaps persist in the use of data or persist in the use of resources that have historically oppressed individuals or communities or populations or not represented them fairly or equally. So we've landed on the notion of doing some scholarship around the broader democratization of CBK. And this is as well linked to the terrific presentation that we had earlier in the annual meeting. Rachel mentioned Michael Fitz's presentation, he's a colleague, but also Sally Auken's presentation, where she focused quite a bit on this notion of the democratization of CBK. Well, that really inspired our group and our work group conversations during the annual meeting. And so what we're doing now is we're working on convening a team to conduct a literature review to look at this topic. And we've got a cluster of folks that have emerged from the University of Arizona and the University of Michigan, the libraries, who are interested in working on this lit review. If others are interested and are participating in this call, you know where I live, Jerry Perry at arizona.edu, and also through the mcbk.org website, you can find me. But we are looking to grow our team that's interested in doing this lit review. And of course, to do a lit review, you have to have a question, and we're working on that as we speak or as we think. And we're also working on a template, memorandum of understanding. We want to pilot a little bit more of a formal relationship between our efforts as the MCBK team and the Association for Academic Health Sciences Libraries. And we want to secure a long-term library society engagement. We think that that's really important. One of the things that warms my heart is the engagement of librarians in this effort. I think that's really critical and important. So we do want to start in our work working with a library association. So I've gone on, and I know that we're running out of time, so I'm going to stop. But I'm really looking forward to it. Questions, and folks, you can always follow up after the fact.
Yeah, that's great. That is wonderful, Jerry. Thank you for that summary. It's a great note to end on. And as usual, I talked too long about all the fun stuff at the meeting, and there's not quite the time for Q&A. But thank you for those that put them in, and I will encourage, just as you said, Jerry, that this is an ongoing discussion. So for next steps, we're going to take the questions and suggestions. Several people mentioned resources, and some, embarrassingly enough, I can't pronounce the acronyms to even share them with you. So we will type that out and share those with an announcement that the meeting recording is ready and to be online. If anyone's interested in joining these work groups, you could go to mobilizecbk.org and sign up for a work group. Then you'll get on the mailing list and you could start participating. And then we will be in touch. We will have future webinars that will highlight these work groups more specifically in more detail and really offer a Q&A in a detailed way in areas that you're interested in. So stay tuned and please do get involved. We'd love to have you. This is really a growing and exciting community, and I think we all have a great vision, and we're getting there slowly. So with that, it's the end of the hour. So thank you all for your attention, and we will follow up as I described. Enjoy your afternoon, and thank you so much for all our presenters and your hard work with the work groups in our steering committee. This was really impressive talks and summaries today. So thank you all. Have a great day. Take care. I hope we can save all these questions.
Yeah, that's what I'm trying to do now so that,
Okay.
yeah.
Yeah, I'm not going to leave in case that messes it up somehow. It shouldn't. But. All right. Well, thank you. Thanks, Janelle, for doing this. Okay. I'm going to head out. Bye, everybody.